Welcome everyone. I'm Anjum Khan, the Director of the Asian Business Chamber of Commerce. Thank you for joining us today on our webinar on business as a force for good, return to prosperity with COVID-safe workplaces with Birmingham City Council. So today we will hear about the latest guidance on keeping your people, clients and customers safe as we emerge from the pandemic. Next slide, please. So my colleague Dan Clark from our policy team will be setting the scene and giving you an overview of the grants and other support available for businesses. And we will also hear from Dr. Julia Duke McRae on the latest updates on the virus and best practice and advice and guidance on COVID safety. We also have our president of the Asian Business Chamber of Commerce, Dr. Jason Vora, who will be sharing a case study of how he, within his business, has adapted to COVID-19. You will have an opportunity to ask any questions to any of our speakers today. What I will request that if you can type away in the chat box, and I will do my best to answer those questions. So on to our first speaker today. Dan, it's over to you.
Thanks, Andy. So I just wanted to just start off by just running through what the Chamber's been doing really during the pandemic to support businesses. So we've run around 209 top stories in our Chamber Link daily. So very much keeping businesses informed of the latest coronavirus regulations, business support schemes, any changes around that, or any new support schemes introduced by the government. Our Chamber employees as well have been making calls to local businesses frequently and our members throughout the pandemic to make them aware of any changes. We've also been updating the coronavirus hub on our website. On that, businesses can go on there and find out the latest advice and guidance around COVID regulations, complying with NHS test and trace, international travel restrictions, and the latest business support via our COVID-19 support grid, which we've updated, I think, around 70 times now. So it's definitely changed a lot over the course of the pandemic, the type of support that have been made available to businesses. We've also been running informative webinars such as this, and we've been hosting Q&A sessions with Chamber members, which is very much creating an opportunity for businesses to learn from each other and share their expertise. We have also been helping businesses through our KBM inbox, which stands for Keep Business Moving. Very much a chance for any businesses that are sort of having trouble with grant payments or any other type of support around regulations that they want to find out more about. They've been able to email into this inbox as well. And we've also been encouraging Chamber members to send in blog posts and other content, basically, on topics such as adapting to working in the digital world and around mental health support, topics such as that during the pandemic. The ABCC Chamber has also been providing coronavirus advice and guidance to businesses in Bengali, Urdu and Punjabi throughout the pandemic as well. So that's very much just an overview really of the type of support that we've been providing at the Chamber since last year. I just wanted to now move on to basically what's the latest really in terms of the government roadmap. So we are now waiting for a step forward, the government roadmap that was initially meant to happen during June, but it's been delayed by up to 4 weeks to Monday, the 19th of July. The government is hoping to remove all legal limits on social contact, subject to review. At step 4 of the roadmap, they'll be also reopening remaining venues such as nightclubs and enabling large events to go ahead really without capacity limits, they're hoping. Birmingham has also in the last few weeks been listed as an enhanced response area to kind of tackle the rising cases, and it's receiving additional government resources for matters such as testing and increasing vaccine uptake. So just to kind of give an overview really of the latest sort of business support. Now the Restart grants are sort of the main grants that the government's providing to businesses. The application process is now closed. It closed yesterday for this. So again, this is providing grants of up to one-off grants of up to £6 for businesses in the non-essential retail sector, and those in hospitality, accommodation, leisure can claim up to £18,000. Whilst the application process closed yesterday, all awards, grant awards will be made by the end of July. In terms of other support, there's the additional restrictions grant. Now this is very much local authorities administering this really. This fund is to help with those businesses that don't qualify for the Restart grants. So those businesses that are not covered by existing schemes, such as those that do not pay business rates directly. The eligibility criteria is very much determined by each local authority, and they will choose where best to target this support. There's also the Domestic Support Fund, which is provided by Visit Britain. It's providing financial support to non-for-profit organisations and charities that are hosting UK meetings, conferences and events that are taking place from 21st of June to 17th of December this year. Organisations can apply for up to £30 per delegate attending an event. And as I say, you can complete an application form for this via the Visit Britain website. Now, there's also the Coronavirus Job Retention Scheme, also known as the Furlough Scheme. This has been extended by the government until the 30th of September this year. There's been some changes from today. Employers are now required to pay 10% contributions, with the government paying 70% of wages. This will change again from the 1st of August to the 30th of September, where employers will be required to pay 20%, with the government paying the other 60%. There's also the Self-Employed Income Support Scheme. Now, claims for the 4th round of grant funding for this have now closed. There will be a further 5th round covering the period May 2021 to September 2021, and applicants will be able to make a claim for this from late July. This scheme has changed just slightly, in the sense that the amount of grant funding for the 5th round will be determined by how much your turnover has been reduced during the 2020 to 2021 financial year. Now, again, this will differ between whether your turnover reduction has been 30% or more or less than that. And if it's 30% or more, you'll be able to claim up to £7,500. In terms of other support, there's the Recovery Loan Scheme. This is very much the successor scheme to the Bounce Back Loan Schemes and the Civil Schemes. Businesses will be able to access loans and other types of finance up to £10 million until the end of 2021. The loan repayment period will be up to 6 years, and businesses are required to meet interest payments from the outset, unlike with the previous Bounce Back scheme. Businesses will have until the end of December to apply for this. In terms of other support, there's a business rates holiday. Now, until yesterday, businesses in the retail, leisure and hospitality sector were able to claim 100% business rates relief. This has now changed to 66% from today until the 31st of March 2022. Just in terms of other support that's available right now, to self-employed, there's universal credit. There'll also be the test and trace support payments. So for people on low incomes that are forced to self-isolate because of being told by the NHS test and trace, whether that be themselves or their child is off sick, they'll be able, if they're eligible, they'll be able to make a claim of up to £500. There's already the statutory sick pay as well. There's also temporary VAT reduction as well for that is 5% at the moment, but that'll be going up to 12% later this year in October. There's the Kickstart Scheme as well, which is providing subsidised work placements for young people that are unemployed. And there has also been an extension recently from the government in terms of protection from eviction for commercial tenants. That will go on till the 1st of March 2022. So just before I hand back over to Anjum, I just wanted to touch briefly on our stakeholder engagement work. Now, we are working with local stakeholders such as Command Authority and the Council, and also nationally through the British Chambers of Commerce to help try and get cross-party support for further funding for businesses and support. I mean, the funding today has been unprecedented, but there are still many businesses that are falling through the gaps. So just a few of what points we're calling for at the moment would be that we're calling for a review to the planned reduction in government contributions furlough payments. I mean, businesses having to contribute more today, but even though the restrictions have been extended until the later in July, the government support, the furlough scheme hasn't been extended in terms of the contributions of businesses have still gone up, even though the restrictions have been extended. We'd also like to see a top up of the additional restrictions grant support. Again, just a reminder, this is the support's being provided to businesses that don't qualify for the Restart grant. The funding for this really is just sort of a drop in the ocean in terms of the businesses that require support. So we're really calling for more support to be given to local authorities through this. We'd also like to see the government bring forward an insurance scheme for live events to try and help support confidence in the sector. So that's all from me now. I will just hand back over to Anjum.
Thank you, Dan, for that insight. So if you require any further information, what I can suggest is if you go onto our website, all the information is available on there, or please do contact one of my colleagues. Now, moving on, I'm going to hand over to Dr. Julia.
Hello, everyone. I'm happy to be here. My name is Dr. Julia Duke-McRae, consultant in public health, and I work for Birmingham City Council. Next slide, please. So what I'm going to cover is the COVID updates, and then I'll give you some feeds on the guidance, national guidance. Well, we've seen an increase in rates of cases across Birmingham throughout the month of June. Currently, the case is about 216.58 cases per 100,000. And we've seen an increase in case rate by 56%. Now, we've also seen an increase in hospital admissions in ITU, and we're now seeing the numbers in double figures. So across all ages, we've seen an increase, but the highest increase has been in the younger age group, so the 0 to 19 and 20 to 39 years old. So across Birmingham, we've been seeing cases right across the city. These cases have been increasing mainly, and there's been inequalities in terms of the wards affected and age groups, as well as vaccine uptake. I'll discuss this further in other slides. Next slide, please. So as I said earlier, the age groups affected mainly are the 10 to 19 and the 20 to 29-year-old. Next slide. So as you can see, we've had a sharp increase from the beginning of June in terms of the ethnic groups, with the black ethnic groups having the high cases right now. But over the long term, we've seen the Asian population having the greatest increase, although that's coming down now. But the highest increase has been around the white ethnic groups, although the black ethnic population have seen the highest increase recently with the Delta variants. Next slide. As I said earlier on, as you can see from this map, we have right across the whole of the city, the Delta variants increase in cases. Most of these cases have been really around the west, central, and southeast. And the main concern has been around the west, because that's where you have the lowest uptake in terms of testing and in terms of vaccine uptake. Next slide. As you can see, this shows how we compare with England. From the beginning of March, we started seeing the uptake has sort of plateaued a bit, although it's been increasing, but it's not as we see in England. The first dose vaccination in the 18 and over is way below the national average, both in the first and second dose. We still have quite a lot of people who haven't been vaccinated. So we have over 370,000 people not vaccinated who have not had their first dose, and over 500,000 second dose. So we still have quite a number of people that need to be vaccinated. Now for the high risk groups, those are the 50 and over, we have over 61,000 people still unvaccinated. Now we know with the Delta variant, which has very high transmissible rate and affecting the young people who then go on and affect their parents, those groups are more at risk of having been admitted in hospital and also developing severe illness. So they need to be vaccinated. Next slide. Because of our high case rates in Birmingham and the low vaccine uptake and low testing rate, Birmingham became an area of enhanced support. And we know that this Delta variant is highly transmitted, and it affects the younger age groups, and there's more likely to be illness around that. We've looked at other areas where this happened much earlier, and we found out that their success rates had been in three main areas. They focused on testing, isolation, and vaccination. Now, the enhanced support package aims to suppress the spread of the virus and break the chains of transmission, and thereby stopping the number of cases we are currently seeing. So next slide. So based on the low uptake of vaccine and testing rates and the high case rates of certain wards, we have identified 15 wards. Now, these wards will be targeted in terms of, ensuring that, there's a door-to-door drop of the LFT testing kits, and we'll focus on areas where we've had outbreaks and clusters, especially in workplaces. They will be offered the testing and support associated with this. We will encourage people to isolate when they test positive, and the environmental health officers will support compliance through enhanced contact tracing. They will check to make sure that people who are infected are isolating, and then there'll be also support for them, which Daniel mentioned earlier on, around them, supporting them in whatever they need to self-isolate. Now, in terms of vaccination, which is the third thing that we hope to encourage to try and stop the spread of the COVID, it is about encouraging people when they're invited for vaccine to attend and get their jabs. We will target those low communities through the mobile van, and also through the pop-up clinics. There's also the vaccination toolkit, which is available citywide, to encourage people, just giving them more information about the vaccine and what is involved and where they can actually get their vaccination. The pop-up clinics, and like I said before, are mobile vaccination van sites. And there's a schedule, which is updated daily. There's a reference there for people to go and find out where they can get their walk-in vaccinations. Now, for those who don't want to, who would prefer to book online, they can either book online or call 119 and book their slots. Next slide. Now, as part of this package, we are trying to make the vaccination more accessible to people. So there's now a walk-in where there's no appointment required. Now, so for those under 40, and there is the Millennium Point and the Aston Villa Football Club, which operates Wednesdays, Sundays to Sundays from 10 to 4. The Baston Cricket Ground for those who are over 40, Sundays from 10 to 4 p.m. And then the whole secondary school for those over 18 from 9:30 to 3:30 p.m. Now, this site below on this slide shows other areas where there's walk-in available as well. Next slide. Now, in terms of how employers can help, every employer has a duty to protect people from harm. That includes not just their staff, but visitors and their contractors as well. So the employers are expected to identify what works activity or situations might cause transmission of the virus within their organization. They need to think about who could be at risk and decide how likely it is that someone could be exposed. And then where that happens, to act to remove the activity or situation, or if that is not possible, to contain the risk. Next slide. So how do you make your workplace safe? The first thing would be to complete the risk assessment, which will help to manage risk and protect people. Now, there's a link there on how to do this, how to do the risk assessment, which is available on that web link. Then the second thing would be to make sure that all surfaces that are likely to be, people are likely to touch are cleaned regularly, and, making sure that their washing facilities hands. Now, the customers are supposed to be reminded, including the staff, to ensure that they wear their face coverings, and that whether they're indoors or when they're indoors, and then to obey this where the law says that they must. So you do not allow any staff within your organization or customer not wearing face masks. Then also to ensure that social distancing and to maintain that. And where that is not possible, you have some kind of entrance and exit where people do not come in contact with each other. Then the fifth thing would be to make sure that there's adequate ventilation. So open all your windows within your establishment, and also to take part in the NHS test and trace. So anyone who comes within your organization should have their contact details, whether they're customers, staff, or visitors, and then to display your QR codes. Then anyone who has coronavirus or has symptoms should be turned away. Now you're to encourage your staff to test twice a week. And if they test positive, they and their household need to self-isolate. But there are information where they can seek help from the council to help them self-isolate. Next slide. So finally, the key messages that I would want everyone to take home would be: ensure that you meet outside rather than inside wherever possible, and where you have to meet inside, make sure there's the social distancing taken into consideration. Now, to follow all the rules around hand, face, space, and making sure that there's adequate ventilations, that the windows are open, and that that people socially distance. That's important, and that all surfaces are kept clean all the time. Now, when you're invited for vaccination, you need to attend your appointment and get vaccinated. That is really important if we're to try and reduce the transmission of this disease. If you are already vaccinated, that does not mean you should stop testing. You need to continue testing, because we're not yet sure whether the virus will overrun the vaccine. So we need to continue testing. And then finally, to continue testing twice a week where that is possible, and employers are meant to encourage their staff to test before coming to work. Next slide, please. Now, these are all the useful information around guidelines, rules, and support, which is available. I'll encourage people to go down to this site and look for more information. Now, finally, what I want to say is that we are trying to encourage businesses to come forward as COVID business champions, so that they will receive information firsthand and provide information to all other businesses. Now, what we're seeing is that there are very few people who have come to these webinars, and we have thousands and thousands of businesses across Birmingham. So it will be really an advantage if some of the businesses offer to be COVID champions to support the other businesses. Thank you. I'll hand over to Anjum.
Thank you, Dr. Julia, for sharing the data with us and giving us more of an insight. So if you do have any questions for Dr. Julia, please do put it in the Q&A chat box, and I will be asking the questions to her shortly. And now we will hear from Jason Vora, who will share his business experience of the challenges of COVID. Over to you, Jason.
Thanks, Anjum. Today, in the next 10 minutes, what I'd like to do is give you a bit of background on what it's been like to trade through this period, and what's been going on in my business, and how we've handled and dealt with the challenges that have hit us in the last year to 18 months. Before I do that, I think that it's important for me to give you a bit of background on my business and what we do and the industry that we're in. My business is Linecroft Wholesale Limited, which was hived out or carved out of East End Foods PLC, which was my family business. My family built up East End Foods over the last 50 years or so, and sold in November 19. Straight away, I embarked on a purchase of 3/4 of that business from its new private equity buyer. So within the pandemic, from say around January 2020, I've been involved in selling a business leading up to January 2020, involved in buying a business, and obviously trading through COVID, which has been challenging to say the least. We celebrated our first birthday of Lioncroft Wholesale yesterday, so we're a year in. We're a completely transformed business and have had to successfully deal with the challenges that COVID has presented. In terms of my background personally, I, as I said, have been a director of East End Foods for many, many years, and now CEO of Lioncroft Wholesale. But outside of my company, I do a number of voluntary roles, and one of which during the COVID pandemic was being a non-exec director of University Hospitals Birmingham Foundation Trust. So I saw from the other side of the coin, not just from a business perspective, but actually how the hospitals were dealing with the pandemic and how challenging and actually quite scary it was. Outside of that, I've been on many boards, chaired many boards, including the Child Poverty Commission, the Institute of Directors. I'm on the board at Aston University. I'm president of the ABCC and also chair of the West Midlands India Partnership, amongst other things. What I want to cover today is the 4 broad areas within the business. So one is how the business generally dealt with COVID-19, how we kept our colleagues and staff safe throughout that very tough period, our supplier relationships and how we've had to handle and maneuver through some very challenging supplier relationships. And I suppose to some would say the most important being the customer relationships and how we handle and advise our customer base. We deal with about 5,000 independent retail stores, bars, clubs, restaurants around the Midlands. Our company is around about 180 million pounds turnover, and we employ 200 people. As I said, we've been in business as a family for 50 years. I personally have been in business for over probably 25 years at least. So, you know, always been involved in the world of business and its challenges. If we look at Lioncroft Wholesale as a business and what we had to do, we started out, you know, we've got 2 very big depots in Birmingham and the Black Country, one in Aston and one in Smethwick, roughly about 25 football pitches worth of space that we sell from. And as I said, we deliver, we deal with a lot of different businesses, mainly independent traders who have found this past year, 18 months, very, very challenging indeed, as we all have. But in particular, trying to navigate the government guidelines, trying to navigate the safety of their teams, trying to run a business in that period. So for an independent business owner, for a small business owner, it is very personal, first of all. And secondly, because they haven't got the resources to have teams of people working on the COVID safety, it's normally left to the owner manager or a very small group of people in management of their businesses. So the challenges are magnified quite drastically for independent businesses, or SME businesses, I should say. We as a company, we incurred immediately costs working from home, adapting technology very, very quickly. I mean, within 2 or 3 days, where people could be working from home, they worked from home. Where they had to be working in our buildings, there was a very strict COVID policy, masks being worn, PPE, sterilisation, social distancing. And in fact, where I'm sitting right now in Aston, right across the road is one of the police headquarters here. And they came and checked our business for a period of 5 days, actually. And we came away with flying colours. They were very happy with the measures being put in place. And bear in mind that these things are done on the hoof and at very short notice. So the challenges for the business were immense. We had to hire a number of temporary staff because out of our 200 people at one point, we had around 60 people off with COVID or isolating due to family members having COVID. So we had to hire a number of temporary staff. Now, the cost to the business, we're in a very low margin industry, cash and carry wholesaling. And those costs, you know, if we're missing 60 staff, we actually probably had to hire about 80 temporary staff to be able to cover the 60, just in case we fell short at the time. We increased security because there was a lot of pressure on our staff, with customers being quite unreasonable at times, and those customers basically, you know, we needed additional security to ensure that during that panic buying scenario where we were back in March 2020, where you saw pictures on the news of people storming supermarkets, that literally happened to our place as well. So immediately, you know, we had to increase security. We had we deal with retailers, as I said, but we had a lot of consumers coming in trying to stock up on things like toilet roll and groceries and chapati flour and you know, all kinds of groceries, ambient groceries like that. And, you know, we had to prevent, obviously, because we're trade only, we had to prevent the members of the public coming in because we're dealing with businesses. It's a B2B organisation. The IT setup was done within a few days. And fortunately, thankfully, we've got a very good IT company that we deal with, and they were able to make us work from home within a matter of a couple of days, and you know, source somehow extra laptops, extra computers that were made available to us. We staggered shifts. We had to work shorter hours as a result, and you know, those health and safety considerations came at a very, very high price. But there was a choice. There was a choice of either closing the place down, which wouldn't have actually in real terms have been a feasible choice, or pay the price and keep trading through it and keep ensuring that your staff and your teams and your customers are in the safest possible environment they can be. We naturally lost sales of restaurants and events trade and casinos and such on. Now that represents around 20% of our turnover. So it's a big hit to the business in terms of the restaurant trade being closed down overnight, and also the fact that there would be credit facilities associated to those restaurants. So there was a certain degree of loss being made as a result of those restaurants sadly being unable to pay their bills. We also had close contact with HMRC and, as I said, the police in terms of checking pricing, because there was another concern that was a lot of businesses were inflating prices at that time to try and profiteer from the panic buying scenario. Now, I'm very proud to say that our business did not increase their sell price at all. And it was more for us, it was about actually getting stock from suppliers at the time in order to be able to run the business. We've also invested in ozone machines, so we clean the air in the buildings. Now imagine 25 football pitches worth of space, and the air is being cleaned by ozone machines every evening in order to make sure that our team and our buildings and our people are safe as possible. Now that's come at a cost of around £100,000 for those machines, which I believe is a very good investment. In terms of our employees, you know, the obvious point here is how do you keep the employees safe? PPE was being sold at a very inflated cost, so I think we invested somewhere in the region of £40,000 to £50,000 in PPE for our staff members, our colleagues. Masks, sanitizers were coming at a massive premium, as most of you will remember. Implementing social distancing within the stores. We're fortunate our stores are quite large, so you know it probably wasn't as difficult as would be in a smaller business. And then the other softer side of things, that supporting colleagues' mental health, because the colleagues are greatly concerned about their safety, and ensuring that they feel safe and they feel comfortable to be at work is the most important thing. We don't want people's mental health to be affected by all of this. So we've had to work through those kind of things. Fortunately, we've not used the forward furlough scheme. We've in fact created 50 jobs since the COVID issues have taken hold. And I'm quite proud to say that, to be honest. I mean, I'm glad we haven't had to furlough anyone. But we have had staff stuck abroad who had gone to meet family and so on in India, Pakistan and such like. And then they were stuck abroad. So we had to work through that. The next area of suppliers is the supplier base. At that time, we deal with the biggest brands, the brands like Coca-Cola, Heinz and such like. And their supply issues immediately were the worst I've ever seen. And in fact, we were made to buy product at full cost. There was no promotion. It was very difficult to get stock, and that damaged our industry. It damaged our business, to be sure, but that has damaged our industry with long-term effects. And unfortunately, you know, some of our friends and colleagues that we've dealt with over the years in business have unfortunately had to shut their businesses down, which is really sad, to be honest. But I don't think the supply chain was quite strong enough, or they focused on the big multiples like Tesco's and Asda's and so on. And that really was a bit unfair, because those independent traders whose lifeblood it is and who provide so much for the economy actually struggled with supply during that time. And we're still facing those kind of issues even today. The area of customers, you know, customers at times would be very abusive to my team members, and we had to actually ask a few customers to leave the building at the time because they were being so rude and obnoxious, and they didn't quite understand that, look, we're all in this together. None of us have bought this on. It's something that's hit us from the outside, the external forces. And as a result, you know, we were left in a position where we had to put some serious rules in place to make sure that the customer base was adhering to the rules, adhering to the PPE requirements and so on. And that was quite challenging, really, because the last thing you want to do is start arguing with your customers. I mean, you know, as I said, the independent retail trade has struggled through this in a big way, and as a result, you know, they've some of our colleagues in the industry have lost their businesses, which is very, very sad. But the future, I think, is bright. We do have to operate in this new landscape, but you know, we are working through, and I think our industry is working through. And it's good to see that restaurants are back and they're busy, and you know, they've got to make up for lost time. So I think I'm overall positive about the future of business in the Midlands as with the COVID pandemic. But obviously, we are working in a new landscape and dealing with the challenges, as we all know, which have been incredibly challenging. I think that's all from me. So I'll pass back to you, Anjum. Thank you. Thank you so much.
Thank you, Jason, for giving us such a great insight. So I'm going to move on now to the questions and answers, and questions have started coming through. But just starting off with you, Jason, then. So Linecroft Wholesale has operated through the past 15 months. And you are a key part of the food supply chain. What have been the biggest challenges for your business regarding implementing COVID safety measures and procedures, and why?
Well, I think COVID safety, I mean, even regardless of the rules around it, it's you know, you have a duty, a moral duty in business to look after the people that are part of your team and part of your customers and your stakeholders. So for us, spending the amount of money we spent, I say we've overspent on safety, but I'm proud that we've done that because it's kept everyone safe, and we've not, touch wood, had any issues around COVID at all in that time. So the 200 people that work for us have been, touch wood, safe and sound all the way through. The challenges for the business were supply, as I said. That March period last year, where there was panic buying, it was the worst thing I have ever seen in my time in business. I've spent my whole life in business. I've never seen anything like it before. And unfortunately, the supply chain, these big companies, these big multinational businesses were unable to cope with the pressures. And that actually had an effect on independent businesses disproportionately to the big multinational, supermarkets of the world. And I think that's unfair. And we're still struggling with supply, but we're working our way through it.
Yeah, thank you for that, Jason. And coming to you, Dr. Julia. So we know the infection rate is high within the ethnic group here in Birmingham. Do we know why our COVID cases rising in Birmingham, and how can we, Birmingham's Asian business community, the business community as a whole, how can we contribute to tackling this? Sorry, Dr. Julia, you're on mute.
Right. First of all, the increase we've seen has been due to the Delta variant, which has taken over the previous UK variant. And that increase has happened because the Delta variant itself is highly transmissible. It is about 1.6 times more transmissible than the previous variant that was in there before. Now, in terms of what, and because we've seen the increase more in the younger age group, as I mentioned before, and they're likely to transmit more they haven't been vaccinated, first of all, and they're more likely to transmit the virus to their parents, so basically the slightly older age groups. And that will be more in those who haven't actually had the vaccines. And as I said before, there are about over 60,000 of the 50 and over who haven't had the vaccination yet. And we're likely to see more of that happening if they don't take their vaccines. In terms of what the businesses can do is encourage all their staff to get vaccinated when they're invited to take their vaccines. Now, we know that there are lots of places available. There's the mobile, the pop-up clinics, there's the walk-in clinics, and now the vaccine uptake or invitation has been brought down to 18 and over. So all adults between 18 and over can actually be vaccinated right now. We also know that the west part of the city, where you have more ethnic groups, have resisted the vaccination. And so encouraging people being COVID champions, telling people that it's actually safe to receive this vaccine, that it will help to reduce the severity of the disease, and it will also reduce hospital admissions and deaths as well. To date, we've had 3,000 deaths, unnecessary deaths from this disease, and we can actually prevent that. Although recently we've seen a slightly rise in increase in hospital admissions, but not as bad as it was before. We've also seen fewer deaths, but not as bad as it was before. But we don't know what this variant will do. So it's better to be cautious.
Cautious in regards to that. I've got a question from one of our attendees, Karen White. And Karen's asking, how do we know that there is a high case rate in certain areas where people are not getting tested?
That's due to the analysis we've done. And that flags up, as you can see from the data I showed you, that it shows the number of people, not just the number of cases, but also the case rates. So you are able to compare between wards. So we have seen that in the western part of the city, central and the southeastern part of the city, we have higher case rates there. And it has been increasing, and it's in the younger age group. So things that we've done has been, one of them would be getting the younger groups because they are the ones who are resisting the vaccination as well. So we've encouraged them to be champions. So they've been going around encouraging their peers to get vaccinated. And so we can also encourage businesses to do likewise, to talk to other businesses, the small businesses that we can't reach, encouraging them to, do the COVID measures, to take into account the space, washing of hands, surface cleaning, wearing face masks, because people are not doing that anymore, and then social distancing. Whether they have had the vaccine or not, they need to continue this COVID preventive measures.
So keep following the rules
Yes,
and guidance from the government.
Yep.
Karen's also asking, how does the NHS know the difference from the Alpha and Delta variant from the testing process?
There is a sequencing that's done with once the test is done, it's taken for genomic sequencing, and that identifies what the variant is. So that is monitored quite distinctly and carefully. And so we identify those variants when they do mutate, because viruses will always mutate.
How fatal is the Delta variant? Karen's also asking on that one.
Well, so far we've seen very few deaths, and we're watching that carefully. And we've seen the hospital admissions has been increasing slightly. We're now seeing double figures, but there's been very few deaths. I think maybe less than 5 so far.
Okay. Jason, so the announcement that Birmingham is now an area of enhanced support, what did that mean for your business?
Well, I mean, first of all, just a couple of things that sprung to mind as Dr. Julie was speaking there. We actually had all of our employees vaccinated a couple of months ago. Out of the 200 that worked for us, there was only 2 that refused. They were given the option, and actually only 2 people turned us down. So we've managed to get everybody double jabbed, and predominantly my team are, I would say, probably about 60% from the South Asian background. So that's really helped us to, bring ourselves into a position of safety. Additional support-wise, I think it's more relevant to the smaller businesses, and I think we have a part to play for retailers to help educate them as to how and what support's available out there for helping them through this period. So I suppose we could be used as a conduit to help educate people.
Thank you, Jason. So what do you think Birmingham and Birmingham's Asian business community in particular will look like post-pandemic? Are the economic impacts of COVID affecting different businesses and communities differently? Jason, that's doing.
I think that there are challenges. The challenges are generically business challenges. I'm not sure that in particular it's disproportionately affecting the Asian community, but one thing we have got is we've got quite a good business network. So we do, our community isn't huge, so it's, we're able to connect with each other, and the more we can do to assist each other through this tough time, the better. So that those kind of losses and those effects aren't disproportionately affecting our community, or our Asian business community, I should say.
Thank you. Dr. Julia, can businesses require that staff regularly COVID test? And also, what about vaccinations? They can't, at present, as we know, that they can't demand that all staff members get their vaccination. But in regards to COVID test,
like I said, businesses should encourage the staff to test twice weekly, and where they are positive, then they need to inform the employers and self-isolate, but also to put the results online, and then there'll be the follow-up from environmental health to ensure that whatever needs they require would be supported in terms of the self-isolation, while payments that Daniel alluded to earlier. That's one. And then with vaccination, I mean, I think, I know you can't force people to get vaccinated, but you can encourage them. And the fact is, we all have a responsibility to ensure that we protect others, not just ourselves, but our family, loved ones, and also our colleagues at work. So, I mean, I think the employers need to encourage their staff to vaccinate. They can't force them, but they need to encourage them, because everyone is responsible towards ensuring that we don't transmit the virus. Sure. And there is also something around, if you don't test, you don't know if you have the virus, and you may be asymptomatic, which means you don't show symptoms, but you can still transmit. So you have a duty to ensure that you do the testing regularly, and if you are positive, stay at home.
Thank you. So, Jason, how have your staff colleagues been in regards to getting COVID tested on a regular basis?
I mean, we've got a number of measures in place in the business, and where people are naturally where they are suspecting that they've got COVID, then they're isolated immediately, and we wouldn't let them in the building and so on. Testing, lateral flow tests are being done, fairly regularly. So I think we're doing all we can really. The staff, the colleagues are naturally hugely cooperative because they understand that it's for the benefit of us all to be safe and sound. So I've not had any problems from my team members at all around the COVID issue. And in fact, I think that the fact that we haven't had any issues in the business is testament to the measures that we've put in place.
Yeah, of course. I have another question from Karen, and that's for Dr. Julia. Isn't it important that the Delta variant is overtaking the previous, as the symptoms are so mild, like runny nose and headache?
Sorry, didn't get that.
So what Karen is asking, has there been an improvement that the Delta variant is overtaking the previous, as symptoms are mild? So is the Delta variant COVID mild compared to the normal one?
Well, so far it hasn't. It's affecting the younger age groups. So we haven't seen, and because the older age groups are vaccinated, they have not, they are sort of protected. So we're not seeing very severe, but there have been some kind of severe illness among the younger ones. So it is something where we're still, the Delta variant is still new, and we're still observing the impact it has on health in the long term. So, I mean, it's difficult to answer that question right now, but so far we've had increase in hospital admissions, but not as the way it was before, and it is affecting the younger age groups more.
Yeah, and is that the under 18s are we talking about?
We're looking at the age groups between the 10 to the 19 and the 20 to 29 age group. So basically students and university or early workers.
Yeah, sure. Thank you. The
other thing I also wanted to mention, if I may say something, is
sure.
that for businesses that have over 100 staff, the mobile vans can actually come to your businesses to vaccinate. So for those who have very large number of employees, right, we could arrange for the van to come over to the site if it's motorable and vaccinate them.
So who would they need to contact for that if an employer would?
It could be through us to the NHS. Yeah.
Okay.
Is that possible for customers as well? So
yes.
Just
all you need to do is tell us where the site is, and and then give a message out to who to your employers that this will happen, and then once that is arranged, we can then inform NHS to come over there in their vans. So that arrangement can be done, but we need to have those numbers and agreement first of all.
Okay.
Thank you for sharing that, Dr. Julia. Just one last question, Jason, for yourself then. What are your ambitions for your business over the next few months as we hopefully move out of lockdown?
I've got very big ambitions actually. I think that's why I bought the company after we'd sold it and the family had exited. I think that the independent trade or the smaller, there is a trend towards people using local businesses for obvious reasons, and we're there to support those local businesses in the food and retail industry. So I feel that the growth potential for that area of businesses is quite positive, and we're doing what we can to kind of expand the business and create more jobs and supply more people and just grow overall in the Midlands and beyond.
Great to hear, Jason. Dr. Julia, any last piece of advice for our attendees today?
Yes, I'll reiterate. Maintain COVID safety, those safety measures, so face, hand washing, distancing, and ventilation, that is key. when you're invited for for your vaccination, please do attend. It not only protects you, but it protects others as well. And then do continue your testing. So if you are positive, it isn't a crime. Inform your employers and then stay at home and contact, the council for support.
Great.
That's it.
That's your message. Thank you very much. Thank you, Dr. Julia, Dr. Jason, and also Danielle Clark as well for joining us today. Any questions, any support required, please do contact us. And I hope you all have a lovely afternoon. Thank you, everyone.
Thank you.
Thank you.